Hi, this is Dr. David Warwick of Warwick Chiropractic and Massage. Lacey, Olympia, Washington. Welcome to our audio blog, Carpal Tunnel Syndrome, and the clinical presentation. We'll try to get to the nuts and bolts of Carpal Tunnel Syndrome. Things that you would experience or will experience in the office is a weakness in the grip and pinch area, and this is can follow up with a loss of sensation, usually around the second to the fourth palm side of the fingers. This intensity becomes more dependent upon the pressure versus the duration of time of the numbness. And what I mean by that is there's a high degree of pressure that occurs inside the carpal tunnel area, almost like a fracture with bleeding into the tunnel. In this, the patients can feel this right away. Usually, carpal tunnel is slow and occurs as a condition of weakness over time, and it comes on slowly. Most patients cannot say, exactly for sure when this all started. Common carpal tunnel type symptom that people experience is they wake up at night and will be shaking the hands to get that feeling back in. So on a physical exam, it's important that we assess the areas of nerve compression. That includes the neck, the shoulder, so we're looking at thoracic outlet, elbow or forearm. So we have to rule out these more, conditions that can contribute to it as well. The list, of types of conditions or diseases that can become a part of this include involvement of a hypothyroid, pregnancy, birth control, menopause, diabetes, kidney disease, arthritis, even Lyme disease, MS, and more. So a physical exam may also include a sensory exam and a motor exam where we're checking skin sensation on the dermatomes, motor on the particular muscles, and to see if this carpal tunnel syndromes are reproduced. Also, your doctor can order an EMG or nerve conduction test, that is electromyography, a nerve conduction velocity, but none of these are 100% sensitive and specific. There can be false positives and negatives. Lab studies and blood tests can also rule out some possible conditions on that. Use of X-ray, MRI, ultrasound can help identify spurs, fracture, cysts, and other types of space-occupying causes of carpal tunnel. So in bottom line, when looking at that on the physical exam, it's a process of elimination and knowing where to go. And you go for in evaluating, so you go from typically least invasive to more invasive in the testing. So tend to be conservative to more invasive in the procedures. What are your treatment options? Chiropractic offers manual therapies, such as mobilization or manipulation, myofascial release of the wrist, massage therapy, but also you want to look at the cervical spine, the shoulder, the elbow, the forearm region, because number one we're looking at is a median nerve. That's a nerve commonly involved in the wrist that's putting pressure on there. Doctors of chiropractic, I utilize sometimes a night splint. You can pick up something from a local drugstore, that can help. Rest, obviously, that's an easy one, but job modifications, that could be a huge contributor to that, either in the past or present. How you sleep at night, if you tend to curl your wrists under while holding the blanket, your blankets, that can put pressure on there. So we want to look at simple and easy things that you can do. If you're looking at reducing inflammation, a lot of times reducing the amount of gluten in your diet or adding some type of anti-inflammatory agent of foods that or herbs and different seasonings of ginger, turmeric, bioflavonoids, your vitamin B, proteolytic enzymes. Those are things that you can do somewhat on your own to help with that process. Being overweight, this is a huge risk. Obviously that puts pressure on there. That type of lifestyle change is another recommendation. If you want to become more invasive in the process, then taking anti-inflammatory drugs can be helpful, especially when you have diabetes or other symptoms like having hormone replacement, those kind of things. When working with carpal tunnel, I often consider in sharing with patients, you need a team approach when working with this. There's not one provider that would be the one fix-all on that, and chiropractic is one of them. And in some cases, depending on how long it's going on, surgery may be necessary. Only if you've tried the less invasive procedures such as chiropractic, the massage, fascial release work, and when all, this is the only option after you've exhausted those conservative options and they have failed. I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington, your local chiropractor here in the Seattle Puget Sound area. Thank you for listening, and you can call our office at 360-951-4504. Thank you.